Good morning, everybody, and very happy New Year to all of you. Sorry, today we are a little bit of delayed because I see only few participants have joined us today. So we thought that we'll give some time to give people, a little more opportunity to join in. Anyway, I think we should start, and if somebody is joining in, they're most welcome. It's quite a long time. I think, there's a long gap initially because of the holidays, and then probably there were some technical problems with CII's web hosting or webinar hosting probably. And anyway, so because of the long gap, I was a little bit of in dilemma because I thought that it would be good at some point of time if we can do little bit of a recap of the previous session so that refresh our minds and see what we have discussed. But today what we'll do is that we'll start the next session, and then if I would ask you that if you think that we should actually have a kind of refresher for in the next session, I will definitely will like to do that. So with that, let's start today's session. As you know that today we are going to start discussions about the thematic issues. So some of the issues we'll discuss. We'll first review the Millennium Development Goal, and based on that we'll try to see that what are the areas of concern, what are the areas we'll have to really work a little harder, and see that what would be the corporate world's contribution to those some of these areas what we have not where we have not done that good. So with that, I will just touch base the last discussion we had in terms of the schedule of corporate social responsibility, section 135 under the Companies Act 2013, and then with that we will start our discussion on the thematic issues, and today we will be discussing on education and early childhood care and development. Now, as I said, that definitely if you are interested and if you feel that we need to do another refresher, we will do it in the next session. So, today let's actually go ahead and start this session. As we discussed that in Schedule 7 of the corporate of Section 135 of the Companies Act, it is describing that in what are the areas the Companies Act really suggests the corporates to invest in terms of corporate social responsibilities. The first was that eradicating hunger, poverty, malnutrition, promoting preventive healthcare. I had mentioned last time that actually there was a case in the court, Delhi High Court, and after that the verdict was that it is, and it was the retrospective, changes were made that it is not only preventive health. Anything what you are doing in health would be included in that. Sanitation and making available of safe drinking water. Under promoting education, we are talking about including special education and employment, enhancing vocational skills, especially among children, women, elderly, and the differently abled, and livelihood enhancement projects, promoting gender equality, empowering women, setting up homes and hostels for women and orphans, setting up old age homes, daycare centers, and such other facilities for senior citizens, and measures for reducing inequalities faced by socially and economically backward groups. Environmental sustainability, ecological balance, protection of flora and fauna, animal welfare, agroforestry, conservation of natural resources, and maintaining quality of social air and water. Protection of national heritage, art and culture, including restoration of buildings and sites of historical importance and works of art. setting up libraries, promotion and development of traditional art and handicrafts, welfare and armed force veteran and dependents, benefits of armed forces, benefit veterans, war widows and their dependents, promotion of sports, training to promote rural sports, nationally recognized sports, Paralympic sports and Olympic sports. And the easiest way and the straightforward way is to contribute your corporate social responsibility fund to the Prime Minister's National Relief Fund. That would be considered as your legitimate corporate social responsibility. Technology incubation in terms of located within academic institutions which are approved by central government, and rural development. As I said that, if you look at this list, there are a lot of overlaps and we see that all these program segments are not in probably at the same level. Like if I talk about eradicating hunger, and if you talk about promoting gender equality, we know that there is a huge gender issue in malnutrition, in hunger issues, in starvation, in sanitation issues. So that when we are talking about eradicating hunger, probably promoting gender equality as an issue should be integrated. It should be an overarching principle rather than a program segment itself. While you are promoting education, again, gender equality should be an overarching principle probably. So, I see a lot of overlapping in this, and I see that, the way it is structured, probably, we see a lot of confusion in the kind of hierarchy of program levels they have, defined in this. At the same time, when we are talking about, say, rural development. Now, rural development, how do you, I can also define that eradicating hunger could be one of the aspects of rural development, or rural development could be one of the aspects of eradicating hunger. Safe drinking water could be a part of rural development also. So, I would say that these are the broad areas, and then we'll have to see that, how do we actually fit in our program areas in this particular framework. So, before getting into specific issues, let us try to see the bigger canvas. In terms of, we'll refer to the Millennium Developmental Goal, because that is the global referral point. The corporates, the developmental agencies, the government, they have all said, and we have agreed that these are the few indicators all of us globally we want to achieve in a time-bound manner. So probably that would provide us a good referral point to really have a scanning of the bigger canvas of a country, socio-economic canvas, and try to see what are those red spots where we should actually focus on, and we should actually see that what should be the corporate sector's contribution to improve upon all these areas. To start with, if you see the first goal, if you refer the extreme left column, the first goal is eradicate extreme poverty and hunger. Now you can see that a lot of similarities actually when the section 135, the schedule 7 was being developed. A lot of referral was drawn from this particular Millennium Developmental Goals, so that you can see a lot of similarities and alignments within these two set of frameworks. Now, in eradicate extreme poverty and hunger, if you see the next thing, the target was next column. The target was to reduce by half the proportion of people living on less than $1 a day. Reduce by half the proportion of people who suffer from hunger. These were the two broad targets we had. The first target, reducing, half the proportion of people living on less than $1 a day. The indicator was percentage of population below poverty line, except group to review the methodology for estimate of poverty. Now you know that we had a lot of discussions and debates on this, that what should be the poverty line in India. What should be the basis of that? How do we calculate the poverty line and all? Actually, we will have little bit of discussion on poverty line and poverty in India while we will be discussing on livelihood aspects. But for now, one thing is clear, that if you take the financial indicator of poverty, there is an improvement over the time. And we see that actually very steadily, the number of people who were living on less than $1 a day has reduced as well as, as per the World Bank data. Now, I'm not referring to the national indicators. I'm not referring to the poverty line. What is debatable at the national level. I am taking $1 a day and $2 a day. In that terms, actually, we see that definitely the people who are living under below $1 a day, that number has been reduced. But if we see that between $1 and $2, definitely we see not much of improvement. Not many people have progressed from $2 and above. So we see a general improvement in that, so that we can consider that as on track. And internationally, actually, it has been accepted that in that term we have made some progress at least. The concern area is the next one, the real concern. Reduced by half the proportion of people who suffer from hunger. Now, this is really a very big concern for our country and internationally also, because if you see the demography of India, even a slight improvement or slight deterioration in terms of Indian indicators, that will actually impact the global indicators even. So the indicator was percentage of underweight children below 3 years. And in that terms, if you see that in 1990, our estimated value was 51.5%. So that in 1990, we are estimating that 51.5% of our children who were under 3 years of age were malnourished or underweight. Now, in 2005-2006, the number was around 45.9. Actually, this is again very, it is, you can understand that, 45.9, it might be more than 50% actually. So the estimated value was 45.9, and our MDG target by 2015, that is this year, by this year, we wanted to achieve, to reduce it to 26%. So we wanted to actually make it half of 51.5, that is 26%, but still we are at around 45-46%. And probably by this year, it would be reduced, but definitely, many findings are saying that it is not reduced so significantly. So that is a major area of concern for us, probably, around 40 to 50%, between 40 to 45% of children in India who below 3 years of age are still underweight. And stunting, there is another report, recent report from World Bank actually. India is contributing the biggest number of children who are stunted in the global data. So that is still there. As I said that, when I will be discussing about livelihood and hunger and poverty, we will get into more detailed discussion on that. That we need to really understand in a little in depth. Now, the next indicator, achieve universal primary education. The target was ensure that all boys and girls complete a full course of primary schooling. In that, indicators were net enrollment ratio in primary education. As we all understand that in terms of enrollment, we have really achieved significantly. And the second indicator was literacy rate in the age of 15 to 24 years. Now, if we look at the value, what it was in 1990, it was 94.6% of children were enrolled. And if we look at the value we found in 2011, it was 99.89%. And I will actually give you a little more data, but enrollment wise, we have done really good. So, and in literacy level, in terms of literacy level, the second indicator, in 1990 it was 61.9, and in 2001 it was 76.4, and MDG goal was 100. So we are doing actually quite good in both of these indicators, so that probably we don't have to give much attention to that, but we will discuss while we will be discussing on education, that what exactly is the concern in education sector. That we will try to understand. Now, similarly, promote gender equality and empowerment. Now, in real sense, what has happened, I really not very sure. But at the same time, if we see that ratio of girls to boys in primary education and secondary education, if we take these two indicators as gender equality and empowerment of women, we have done quite good. Now, again, you can see that, what are the indicators we set. So when we will be discussing about our program development and other things, then also we'll have to understand that how do we set those indicators and really see that what should be the indicators, what will capture the progress or, decline in that particular aspect. Now, if you see in this particular case, ideal scenario, ideal case to really discuss. See, the goal we are setting, promote gender equality and empowerment of and empower women. In that, if we take these two indicators and selectively, and if we don't take other indicators, it looks really good. So, if we take the scope of this MDG goal and this particular framework, we will say that according to the target set and the indicators, we have done quite well. Now, in terms of reducing child mortality, the target was reduced by 2/3 the mortality rate among children under 5. So under 5, the indicators were under 5 mortality rate per 1,000 live births and IMR per 1,000 live births. IMR is infant mortality rate. So what was the scenario under 5 mortality rate per 1,000 live births? In 1990, 109 was the mortality rate. In 2011, we have reduced it to half, 52. MDG target is 42. So if in 2011, 52 was there, and if you see the reduction rate, probably by today, 2015, it would be almost touching to 42 or quite close to the target as per the official data. Infant mortality rate was 80 in 1990 per 1,000 live birth, which was reduced in 2011 to 42, and we thought that by 2015 it would be reduced to 27. Now again, if you look at the reduction rate in mortality, definitely I would think that if that is the rate and if we maintain the rate, if that is the trend, then probably by 2015 we will be very close to the target, or we will achieve the target. Now here we don't have the scope in this particular discussion to really assess or validate this data or authenticate this data. These are all official data. So what we are doing is that we are referring to our official data, which is accepted nationally, internationally, and we are trying to see that there is a significant improvement on that. Now, even if there is little bit of problem in the data, national or international data, what we are projecting today, what I got from national statistics, even then I would say that these are all encouraging trends. At least if there is little bit of 0.5% error, 0.3% error is definitely, as you can understand, that it is acceptable, but then is a little bit of more error also, then also we see that there is a trend of improvement, and it's quite significantly good. Now the concern area is goal 5, improve maternal health. The target, what we said, reduce by 3/4 the maternal mortality ratio. That means 75%, we will have to reduce by 75%. The indicator was MMR, maternal mortality rate, per 100,000 live. When we try to see the rate, we try to calculate the rate of maternal mortality, we take per 100,000 live births. That's the denominator. Now, per 100,000 live births in 1990, we had 424 MMR. So that 424 mothers per 100,000 live births were actually dying. In 2007-9, the number was reduced to 178, and what we thought that it would be by 2015, it would be 109. So again, there is a significant reduction, but at the same time, not at the rate that we can probably reach to 109. Second thing, we see that in terms of MMR and IMR and all these things, after a lot of inputs, after a lot of really, initiatives, all these reductions have come to a kind of threshold level. So we see that, up to that level, we see that direct correlation with our inputs and initiatives with reduction of that rate. But after that, we see that it is not that the same kind of correlation we have. So that, we continue to give that kind of inputs and, investment, but still the change in rate is very, very low, right? So that there is a kind of threshold. We'll have to see that. Now that is the toughest situation actually. When we, in any, in terms of changing the scenarios, when we reach that particular threshold, after that we need to see that, what kind of different approaches we'll have to take to really, break that threshold, and then, see that what kind of changes we can bring in. So at this point of time, we, I think that in terms of IMR, MMR, and even, under 5 mortality rate, we have reduced that threshold, and we need a very different kind of approach and very, very intensive initiative so that we can actually break that particular status quo. Now, in terms of HIV/AIDS, malaria, next target was, next goal was, goal 6 was combat HIV/AIDS, malaria, and other diseases. In terms of at least HIV/AIDS, we have done quite good. So it is not an area of concern. In terms of malaria, if you see that the second target was have halted by 2015 and begun to reverse the incidence of malaria and other major diseases. So two major diseases we are really still now struggling with. One is that malaria, and second is the tuberculosis. So in these two cases, actually we see that we are still, it is under progress. It's an enormous work to do, but still, some progress we have made. While we will be discussing about health issues, we will actually have more detailed discussion that, why it is so significant that, we should focus on malaria and tuberculosis. And, it would be quite revealing while we'll be discussing the health issues in probably the next session. Now, if you look at the 7th goal, ensure environmental sustainability. In terms of safe drinking water, at least access-wise, I would say that, not so much of quality-wise. If you look at the reality, ground reality, we see that access we have achieved quite a bit. In 1990, the indicator was percentage of people using improved source of drinking water. Now again, the indicator is improved sources of drinking water. Now, whether that particular drinking water, we have ensured quality of drinking water, sufficient drinking water, and all these things, that's the next level question. So we have not set indicators about that. But if we take only access to safe drinking water sources, if our, measurement is limited within that, then we see that in 1990, we had 68% people who were accessing safe drinking water sources. In 2010, the value was 92, and the MDG target was 88.5, so that we have overachieved. Again, I mentioned that, I draw your attention that the indicator was on access to safe drinking water sources, so that we see that, how we have set the indicator, right? And I am drawing your attention not so much to criticize this, but also I am actually trying to initiate a discussion what we will be using when we will discuss about our program development and how to actually monitor the program, how to evaluate the program, how to set the indicators. Then probably we can actually draw examples from this and try to see what kind of indicators we'll set. Now the problem area, as we all have been discussing, we have now this Swachh Abhiyan, percentage of households without sanitation facility. Now, if we see that in 1990, 70% of our households did not have any sanitation facility, any kind of sanitation facility. That is what we are talking about. 2010, the number was 51, and we wanted to reduce the number to percentage to 38. But as you know that probably till now, 2014-15, around 50% of our households are still not having, any kind of sanitation facility. In terms of improved sanitation, percentage of people using improved sanitation facility, in 1990, we had 18% of people of our populations who had access to improved sanitation facilities. Again, I will discuss all these things, what is improved sanitation, what is generally sanitation facilities, while we will be discussing on health and hygiene and all these issues. But for now, if you look at the progress that in 2010, we have our 34% of population has had improved sanitation facilities, and we wanted to reduce the number to 64 by 2015, and definitely what we could not achieve. So this is another area, and very rightly, all of us are now discussing about sanitation, and we see that it is not only having sanitation, it has impact on other issues also. It has impact on education, it has impact on malnutrition, it has impact on economy, and so that, this is one of the areas probably that requires a lot of attention from all government, private sector, NGOs, everybody. Now with that, let's start discussion about elementary education today. So that the first phase, as I said, that there are, in the first module, what we have discussed about the conceptual framework of corporate social responsibility. We try to understand what are the kind of global frameworks are evolving, how, conceptually it is evolving globally. As a concept of corporate social responsibility, we try to see that what are the kind of trends in terms of corporate social responsibilities. We wanted to see that in terms of Indian legislation, what are the provisions and what are the frameworks we have. And then after that, what we tried to do in the module 2, second module, that we wanted to focus on some programmatic aspects, thematic aspects. Again, when we started the thematic aspect, as we did just now, is that we wanted to see that what are the gray areas, what are the actually, areas where actually focus on. So we saw that we identified few areas. We referred to the Millennium Development Goal, and we saw that, in few areas we have done really good. In few areas, still we could not do much. Now, as I said, that the indicator we set in education was more of an access indicator, that how many children are being enrolled and how many children are being even completed their primary education. Now, let us go through that and try to see what is the real concern in education today. Now, just to give you a little bit of context, India is one of the countries where education is a fundamental right. Elementary education is a fundamental right. So what we are saying is that every child between the age of 6 to 14 years has the right to free and compulsory education. The government schools shall provide free education to all the children. Private schools shall admit at least 25% of the children in their schools without any fee. Now, if you see what the way it has evolved, some of the right to education milestones, if you look at, In 1950, the Constitution had resolved in Article 45 under the directive principles of state policy. Just mind it, it was actually in the directive principle in the state policy. States shall endeavor to provide within a period of 10 years from the commencement of this Constitution for free and compulsory education for all children until they complete the age of 14. It was in the directive principle. In 1968, we had the National Policy on Education. Again in 1992, the National Policy of Education was refined, revised to achieve universal elementary education. One of the biggest milestones was the 42nd Amendment of the Constitution in 1976, because till now education was a state subject. This is the first time education was brought into the concurrent list, so that it is not only the state, the central government is also responsible for elementary education or education. In 2002, another significant step, because in 2002 we had the 86th constitutional amendment to make elementary education as a fundamental right, so that in 1950 it was under directive principle. Now it is one of the fundamental rights of our Indian children. Following that, in 2009 we had that Right of Children to Free and Compulsory Education Act 2009, so that according to the constitutional provision, now we have a legislative framework that if every child has a right to elementary education, compulsory education. Now, this is a quite significant progress, I would say, from 1950 to 2009 as a legislative framework, as provision, legislative provision. Now, let us look at the ground realities. The anchor program in education from public sector, the government education program, is the Sarva Shiksha Abhiyan. Now, if you look at the Sarva Shiksha Abhiyan, what are the goals we had set? All children in school, education guarantee center, alternate schools, back to schools. These are different kind of schools, set according to the situation, so that we have, we can maximize, optimize the access to educational institutions or schools. All children in school, that was the first goal. So we have done quite good in that term. All children complete 5 years of primary schooling by 2007. All children complete 8 years of schooling by 2010. Focus on elementary education of satisfactory quality with emphasis on education of life, for life. Now this is what the core issue probably. We'll discuss on that. Focus on elementary education of satisfactory quality. Now this is something probably we'll have to see. Okay, 100%, around 100% children, probably it would be 97% children are going to the school now. They're spending number of years in the school. I don't know if there's any problem. Can you guys please confirm if you can hear me? I'm getting some kind of sound. Okay. Thank you so much. Thank you so much. We'll continue now. Listen. Okay. Now what we are discussing is that, okay, access wise we have done quite significantly good. Probably 97, if it is not 100%, it is 97%. There are more, I would say, finer issues in access, but for now we will say that, okay, access wise we have done quite good, but probably we'll have to see what is the quality of education. We'll again see that whether what we are saying is that a valid statement or not. Is that a real concern or not? Now, bridge all gender social category gaps at primary stages by 2007 at the elementary education. Probably this is also something we need to understand, and we really need to assess and try to see that, okay, is it an equitable access what we have created? And universal retention by 2010. Okay, let us go to the next stage, and then probably we'll discuss all these parameters again. Let's skip this. I have a different slide. Probably that would be easier for you to understand. Now, okay, I mean, if you look at this 2005-6 data versus 2019 data, we see quite a bit of achievement. If you look at the percentage from 1, 2, 3, 4, 5th row, that is gross enrollment rate at primary level is 103%. What we achieved in 2005-6 and 2009-10, we have achieved 105.6%. That means why it is more than 100%? Because number of children, they get enrolled, they drop out, again they get enrolled. So that, you know, in many cases, the same child actually double, you know, enrolled twice, thrice, or more than that probably. So that, you know, it should be, the gross enrollment rate should be actually more than 100% always because of the dropouts. If you see that net enrollment upper primary was 43.1% in 2005 and 6, 2009 and 10 it was 58.2000. In recent data 2014 it is around 97%. Elementary enrollment in government schools plus aided schools 126 million versus 146 million. Out of school children, that is also reduced in these years very significantly. It was 13.4 million in 2005-6 and in 2019 it was 8.1 million. We have more recent data, we'll get into that. Now, few are the mysteries what we'll have to understand, and probably it requires a little bit more in-depth research to understand these trends. If you look at this dropout from 2004 to 10-11, 4-5 to 10-11, we don't see any trend. Overall, it has reduced. You know, look at this: 0607, 8.6%. From 10, the previous year, it has reduced to 10.6%. Next year, again, it is increased. Dropout rate 9.4%. Next year, again 8.0%. Next year, 9-10, 9%, 9.1%. 10-11, 6.8%. So that we see a fluctuation. You know, we don't see actually it is reducing in a quite, you know, smoothly. It does not show us a trend. You know, we see broadly actually if you compare from 4-5 to 10-11, 6.8. If you compare 4-5 to 9-10, it is 9.1 versus 10.6, right? So we need to understand that, you know, there are so many other factors, you know, that we can accept that, you know, the access has increased, number of schools have increased, infrastructure wise, you know, it is much better infrastructure than before. But what are the different aspects? What are the different other factors which is impacting into more, I mean, fluctuating dropout rate? That is something we need to understand in our local areas. And I would say that in India, it is very difficult to say that this is the particular factor. I would say that in different, you know, socio-economic backgrounds, in different state of a society, in different localities, in different, you know, geoclimatic zones, we have different kind of situations which is impacting on that. So that we'll have to have more comprehensive approach to education now. It is not only education. For example, the year we have a good cropping, we see a good enrollment rate. The year we see a lot of migration because of distress in terms of agricultural distress. We see a lot of dropouts from the schools. So that it is not only school, it is not only giving teachers, it is not only within the classroom. There are so many other factors impacting our education system. So that we need to understand that it is much more than what we see in the educational institutions and the system. Number two, if you see the grade-wise annual dropout rate, you see the same trend almost we have in terms of, you know, 2009-10 and 10-11 data. you see a huge dropout rate, it is increasing from grade 2 to grade 3. There is a decline from grade 1 to grade 2. If the dropout rate in grade 1 in a particular year was 78%, in grade 2 it was 3.9%, that's a decline. Between grade 2 to grade 3, it is again increased, 4.9. Again, it is almost the same, 4.9, 4.2. So that we see there's a dip in grade 2, again there's a little bit of increase in grade 3, grade 4. Now we can understand that grade 1, little bit of higher dropout rate because it's the first time, many children, first time in the family they are going to the school, first generation school goers, first time in their lives they're going to the school, there will be a little bit of fluctuation, they will drop out, they will stop going to the school, again start going to the school. That might happen in the rural areas and all these things, so that that is understandable, though that is not acceptable. But we see that in between 2000 and between grade 2 and grade 3, there's a dip. Now we need to understand why it is. And practically, wherever I have traveled across India. I have seen, many schools across India. I have studied education system in, almost 15, 16 states. We see that's actually a very common pattern across the states. That between second standard to third standard, there's a huge dropout rate. It's because probably the children cannot cope up with that school situation, and there will be many other factors, many other factors, right? So this is another mystery what we'll have to really understand. And we need to, when you guys are taking up the assignments, if you all are interested, look into those critical matters. These are big mysteries in education sector, and we have assumptions. I can give you 10 assumptions, but I am actually restraining myself to give those assumptions because I don't have scientific data to really prove my assumptions. So probably some of you might like to look into this and try to see why it is so happening. And believe me, this is a significant number. Percentage wise, it is not much, it looks like, but it is a significant number, as you can understand if you take consideration of the number of children in India. Another aspect in this, if you look at, forget about all these, data, just look into the compare between scheduled caste, scheduled tribes general, girls and boys. Now you see always there is a trend that scheduled tribe girls, if you see in 2003-4, 2007-8, 2009-10, the dropout rates are much higher than the others. Even their dropout rates are higher than scheduled caste boys. So that, and scheduled caste overall, scheduled tribe overall, dropout rates are higher than the other caste. So that we see in education system, again, there's a caste dynamics, there's a gender dynamics, right? As I was saying that, if you are having an education program, gender equity should be an overarching principle in education program, whatever the program you do. But in education, as we can see that if we don't address the gender issues, if we don't address the social group issues or the caste issues or, the minority community issues, definitely what you are doing is that you are not, it would be very difficult to achieve your educational goals. Now, let us look at some of the very recent data, to 2014 data. We will refer to CSR study. As you must be knowing that CSR study, actually they look into all our education system and try to see what is the major focus is, I would say that, to me at least, the outcome of education. Now, if you look at the enrollment in private school, this is another very important trend that we see, that more and more children attend to, or more and more parents tend to take their children to the private school, and they prefer private school more than the government schools. Even in the poorest of the poor areas, if there is a private school, and sometimes if you have visited those rural areas, you will see, private school, so-called English medium schools, so-called convent schools. Yeah, it is not probably convent school, but a board written on that convent school is enough to actually attract children. A board saying that it is an English medium school is enough to attract children. So more and more children or more and more parents are getting attracted to the private school. Now, why? That is something we'll discuss. But let us look at the trend. Now, this is 2006 scenario. Now, the legend is very, very small. So I will tell you. Red is 0 to 9. The range is red is 0 to 9. The orange color next to that is 10 to 19. Yellow is 20 to 29, like that. Only the last one, is being called purple, whatever it is. The last one is 50 to 60. Sorry, it is 60 to 80%, 79%, like that. So that is the bigger range. Other than that, all at range of 0 to 9, 10 to 11, 10 to 19, like that. Now, if you see that, if you look at this map, mostly orange and red, there are few areas where light green is there. Light green is 0 to 9, 10 to 19, 20 to 29, 30 to 39, like Jammu, Kashmir, Uttar Pradesh, there is number of children are going to the school, to the private school. If you see Kerala, Punjab, Haryana, Meghalaya, these places, again, lot of children, Nagaland, these are the places, number of children are going to the private schools. Now let us see that, whether this trend of going to private school increasing or not. Now let us look at 2009 data, the same study. We see that green is increasing, yellow is increasing, red, that the minimum range, and the orange is decreasing, right? So that more and more children are going to the school, private school. Now if you look at the recent data, 2014, remarkably it has increased. Remarkably it has increased. So around the recent data is, I will give you the more data actually. Recent data is that more than 30% of children are going to the private schools. And I'm not talking about only cities and towns, I'm talking about all over India. So that in rural areas also, more and more children are going to the private educational institutions. But now, why this is a trend? You know that many of the government schools in many places are getting closed because the number of small schools are increasing in terms of government schools. Small schools because, whom would we call small school? Where we have not more than 60 children in that particular whole school. So that number of small school is increasing day by day. And in number of places, we see that in all over India, we see the trend that government is forced to close down many government schools because they don't have enough number of children to run the school. Now let's look at the access data, 2014 data. 2014 is the 6th year in a row the enrollment level are 96% or higher for the 6 to 14 age group. As I was saying that it is almost 97% enrollment rate. The proportion of children currently not in school remains at 3.3%. Now, we are saying again percentage wise 3.3 looks very small, but if you look at the absolute number of the children, it's quite big, right? So it remains as a concern, but I would say that the progress is quite good. India is close to universal enrollment for the age group 6 to 14, with the percentage of children enrolled in school at 96% or above for 6 years in a row. So it's a kind of upward trend. Very, very steady improvement. Nationally, the percentage of children out of school, age group 6 to 14 remains at 3.3%. The same as the figure last year. So we see quite a bit of steady status. In some states, the proportion of girls out of school remains greater than 8%. These states are Rajasthan, Uttar Pradesh. Now again you see, these two states, Rajasthan and Uttar Pradesh, consecutive 2 years at least, I see that in 2013 and 2014, the girl children who are out of school is much more than the national average. It is not only this year's trend. It is not all of a sudden. Yeah, it is a characteristic of those states, right? 12.1% and 9.2% in terms of Uttar Pradesh, 12.1% in Rajasthan. Now, we need to understand that why in those two particular states, more girl children are not going to the school. And if any of you are working on those two states, definitely you need to focus on that. Although enrollment levels are very high for the age group covered by the Right to Education Act, the proportion of 15 to 16 years old not enrolled in school is substantial. So as I said that, one point is that 2 to 3, I mean second year to the third year of formal schooling, second standard to the third standard, there's a huge dropout rate. Another dropout rate is just the between fifth standard to sixth standard, or primary to higher school, or middle school to higher school. So that whenever we see there is a kind of graduation level, we see that there is a huge dropout rate. Except that second standard to third standard, there are different kind of set of factors for that. So this statistics again supports us to say that the proportion of 15 to 16 years old not enrolled in school is substantial. One is that in many cases 15 to 16 years, this is the adolescent, pre-adolescent, adolescent age, many girls actually drop out from the schools, unfortunately. And for girls, one of the major factors is early child marriage. One of the most, significant factor. For boys, there are different kind of situations. It might be livelihood. For girls also, there are livelihood pressures. They will have to earn money. They start getting difficulties to cope up, because if you see that the cumulative, difficulties from first standard to eighth standard they get, it's difficult then after that to actually cope up with the board examinations and the syllabus. So there are again different factors, but again we see there is a gender gap. More girls, again you see that, the factors of the girls, they have a different, significant factors than the boys. So again we'll have to understand that gender equity and, gender perspective in education is a very, very important perspective. Then we see the proportion of children enrolled in private school has increased. As I was showing the trend from 2006 to 14. It is saying that, from last year, this year also it has increased slightly. In 2014, 30.8% of all 6 to 14-year-old children in rural India are enrolled in private schools. This number is up slightly from 29% in 2013. As in previous year, in each age group, a higher proportion of boys go to private schools as compared to girls. Again, look at this. We have a huge gender issue in education. Now, if you look at, I have visited many families, I have seen the boy is going to the private school and the girl is going to the government school. Because for that family, private school is quite a bit of investment, and they want to make that investment for the boy. They don't want to make that investment for the girl. Next point, if you see it, compared to similar figures in 2013, there has been an increase in private school enrollment. The only exception to these are Gujarat, Maharashtra, Uttarakhand, Nagaland and Kerala. Except those states, in all the states actually there are increase. Significantly, some of the states actually have more than 50% children in rural areas who are going to the private schools. More than 50% children are going to the private school. Which are those states? Manipur, 73.3% of children are going to the private school. One of the major areas, see, these are again very, very area specific features. Now in Manipur, as you can understand, probably the government education system, is not that robust one. Access problem is definitely there, and also there's a very significant initiative of, and very, very traditionally, in Manipur has a lot of initiative by the Catholic churches. Yeah. Because of that, there are many schools run by fathers and nuns, and their spread is quite good, and they're very, the access wise, they have actually contributed a lot in those areas. In Kerala, 62.2%, Haryana, 54.2%, Uttar Pradesh, 51.7%, and Meghalaya, 51.7%. So these are the, states where we have more than 50% of children going to the private schools. Now let us actually get into the core issue of quality of education. Now see, what we can do is that we can put all the children in the school. If you see that going to the school is quite a bit of investment for any family or even the child, because number of years they are spending in that particular institution, and we'll have to look at what is the outcome. For me and you, if we are sending our kids to a school, we are paying for that, we definitely go to the school and say that hey, nothing is happening, my child is not learning anything, so what you are doing, because there is a sense of accountability. Now, if it is a government school, in most of the cases, the perception is free education, so that they are not answerable to that. It's not true. Now, in most of the cases, again, how do you ensure that sense of accountability is there, so that parents can question the teachers? Parents can actually, it's not only question in term negatively, but also support the teachers and the schools, so that actually it's a good investment for them to send their children to the schools. And it is all tax-based money, right? So that there is a huge issue. Now, in the outcome, and outcome is very, very important. It is not enough that, our children are going to the school, certain number of years they are in the school, and they are probably in our education system, they got a good result, got some marks, and they passed out of the school and progressed to the next level. That's not enough. But let us see that what exactly is the outcome in real sense of this educational system. Now, if you see that one of the indicators, if you pick up, that is percentage of 5th standard children in government schools who can read standard 2 level text. So that a child who is reading in the 5th standard, class 5, who can read the text of class 2, 2nd standard, even it is their mother tongue, their first language. Let us look at that situation. Again, the legend is the same, 0 to 9, 10 to 19, 20 to 29, like that. Lowest is the red and highest is that whatever that, purple or indigo, the last one. Now, if you see this, we find 3 states who have this purple: Madhya Pradesh, Kerala, and Mizoram. Right? In these 3 states, we see that more than 50% of the children at 5th standard who can read 2nd standard level texts. We find many greens in 2006, and definitely some of the states, actually Karnataka, Tamil Nadu, some of the states are really, really red, and we see that huge concern. Jammu Kashmir is a concern, Uttar Pradesh is a concern, some of the northeastern states are concerned, Nagaland and Manipur were areas of concern. Now in 2009, if you see how it changes the scenario, it improves a little bit. We see that Maharashtra has actually achieved a lot. Then we see Himachal Pradesh, they have also really, done a little better. If you see the previous year, we had Kerala also, but you see in the next year, Kerala has actually declined. In Northeast, actually we had Mizoram. Now, in the next year, again, it has declined. In 2014, if you see that again there is a new trend. Uttar Pradesh, Madhya Pradesh, one of the best states. We see really, drop in terms of the quality of education in Madhya Pradesh from 2006 to 2014. So now Madhya Pradesh is the area of concern. If you see the 2006 data, Madhya Pradesh was doing quite well. Uttar Pradesh was doing, not that bad. Bihar was not doing that bad. Now you see in 2014, actually Uttar Pradesh is doing really bad. Madhya Pradesh, from purple, it has reduced red. Jammu Kashmir, it is red. Jharkhand, it's red. Kerala is not as good as it was, and we see that it's a kind of mediocre. Rajasthan is not red, but it is pink or, whatever, saffron. And we see that Assam is also getting into a saffron. So that we see that actually in terms of reading skill, there is no improvement. Rather, we see that actually it is an area of concern, and, we have really negative, progression in this on this particular indicator. Now, what is the specific situation? Overall, the situation with basic reading continues to extremely disheartening in India. In 2014, in standard 3, only a fourth of all children can read a standard second text fluently. So that children, only 25% children who are reading in third standard, they can read second standard texts. The number rises to just until half in standard 5th. Even in standard 8, close to 75 children can read standard 2 level. That means even in class 8, 25% children cannot read the text of second level. That is the situation, the basic reading skill. And I'm not talking about English, I'm talking about even their first language. Some very small improvement in reading are visible in the last few years. For example, the proportion of standard 5 children who can read at least a standard 2 level text has inched upon from 46.8% in 2012 to 47% in 2013 to 48.1% in 2014 at a national level. So that till now, according to this survey, within the scopes and limitations of this particular survey, 48% of our children who are reading in 5th standard, they can only read second level. Only 48.1% children can read second standard level text. 38.7% of standard 3 children could read at least a standard 1 level text in 2012. This number is slightly higher at 40.2% in 2014. So this is abysmal. I mean, this is something really, as a good indicator to see that what is the outcome, what children are really learning in the school. In some states, reading levels have improved since last year. For example, in 2014, a higher proportion of children in standard 5th in Himachal Pradesh, Haryana. Bihar is little bit of doubtful because we see a deterioration in Bihar, so I don't know whether this is an error in the research. Odisha, Karnataka can read at least standard 2 level text than was the case of last year. Tamil Nadu shows major gains in reading over last year for standard 5. So this is only one state we see a steady progress. If you again go back to the map, you see Tamil Nadu was really a red zone, right? Only 0 to 9%. Now in the next year, we see that Tamil Nadu has progressed to the orange. And again in 2014, we see that it is a very steady progress. Tamil Nadu has entered the light green zone, right? So that we see that in Tamil Nadu, there is a very steady progress and there is no fluctuation. We see that there is a steady progress from one level to another. It is actually progressing. Now, looking at the trends over time, in many states, the reading status of children is largely unchanged. However, in some states like Bihar, Assam, Jharkhand, Chhattisgarh, Madhya Pradesh and Maharashtra, there are visible declines in reading levels over the last 5 to 6 years. So forget about improvement of the situation. In those states, actually there is a decline. So lesser number of or lesser percentage of children can read. Even if the children are reading at 5th level, lesser number of children comparing to the previous years, they can read the 2nd standard text. As you can understand, this is obvious that in terms of English, it is actually worse. Children ability to read English relatively unchanged in lower primary grade in 2014. About 25% of children enrolled in standard 5 could read simple English sentences. This number is virtually unchanged since 2009. However, a decline is visible in upper primary grades. For example, in 2009, 60.2% of children in standard 8 could read simple sentences in English, but in 2014 this figure is 46.8%. So that 60.2% to 46.8% it has declined in terms of reading English sentences who are studying in standard 8. Simple reading, simple sentences. In 2014, of those who can read words, regardless of the grade, roughly 60% could explain the meaning. So 40% could not explain the meaning, regardless of the grade. Who can read, but comprehension is nothing. So that why reading is so important, because it is a self-learning process. When a child learns to read, they comprehend and they start learning by reading, right? So that the reading skill by themselves and comprehending what they are reading is more important. It is not reading like, they can read a sentence, but they don't understand the meaning of the word and the sentence. So reading in real sense is actually also comprehension. So you see there is a decline in terms of English reading. In 2014, of those who can read words, regardless of grade, roughly 60% could explain the meaning of the words to read of those. So that, it's a lot of data, but the crux is that reading skill in terms of the first language and even the English, we see a lot of, that still remains as a concern for us. Now, another important area when we assess the quality of education in terms of outcome of education, that what the children have learned, the learning level, learning outcome. Another area, as you can understand, is arithmetic. Now, in this particular slide, we'll see that state-wise percentage of 5th standard children in government schools who can do divisions. Here we mean divisions by 3-digit number to be divided by a single-digit number. That kind of division. It's not a complicated division. A 3-number digit to be divided by one-digit number. A 3-digit number to be divided by 1-digit number. That is the kind of divisions. That is the kind of test was taken. And what was the situation? Again, we will take 3 years comparison. In 2007, this was the situation. We don't really see any red area, right? Couple of states, Karnataka and Tamil Nadu, was in orange areas. There are 1, 2, 3, 4 states in even that last purple areas, or whatever it is. To me, it looks like purple. West Bengal, Bihar, Madhya Pradesh, Himachal Pradesh, those are actually in purple areas. Few states were in blue or indigo areas. Punjab, Haryana, Uttarakhand, in Northeast. Now let's look at next year what happens. There are 4 states in purple areas. Here it is 3 states in purple areas, right? There were 1, 2, 3, 4, 5, 6, 7 states. If you see that broad picture nationally, here 1, 2, 3, 4, 5 states in indigo. Now, strikingly, let us actually jump to the 2014 data. Let's see what is the situation. Now, this is a concern. What are those purple, indigo, those states? There was no red area. Now there is red area. And most part of India is actually orange. That is only the second level, 10 to 19%. This is a real concern for us. In terms of arithmetic skill, we are actually going down. The All India rural figures for basic arithmetic have remained virtually unchanged over the last few years. Overall, we are talking about in 2012 to 26.3% of standard 3 children could do a 2-digit subtraction. This number is at 25.3% in 2014. Little bit of reduction, 26.3 to 25.3. For standard 5 children, the ability to do divisions has increased slightly from 24.8% in 2012 to 26.1% in 2014. There are other trends which are quite worrying. For example, the percent of children in standard 2 who still cannot recognize numbers up to 9 has increased over time from 11.3% to 19.5%, 2009 to 2014. Similarly, the ability to divisions among standard 8 students has been dropping since 2008. Again, I said that for 8 students, the test was a 3-digit number to be divided by 1-digit number. That is a kind of simple test. Dropping since 2010, the proportion of standard 8 students who could correctly do a 3-digit by 1-digit division problem was 68.3% in 2010. This number has dropped to 44.1% in 2014. Right? So that 24% drop from 2010 to 2014. So that is a big concern. Few changes are visible since last year except in Tamil Nadu where there are improvements. So you can see that the one state has really progressed steadily in terms of educational outcomes, that is only Tamil Nadu. Now, till now, what we could understand? We could understand that learning level has still remained as a concern, in terms of reading skill, in terms of arithmetic skill, reading in terms of, again, their first language or English. In terms of access, yes, definitely we have made good achievement, but still 3.3% children are out of school, and there is a caste gender dynamics, what we actually look into. We see some of the skewedness in some of the states in terms of girls out of school. In UP and Rajasthan, we see that more girls than other states are out of school. So when we talk about education system, then we'll have to get into those finer details. And broadly, we see that our problem is not primary problem. I would say that access still remains as a problem because girl-wise, caste-wise, there is a trend, and absolute number-wise, that 3.3% is a big number. But the primary problem is in quality. What is the outcome, learning outcome? If they go to the school, what they learn. So unless and until we can achieve those learning outcomes, definitely only sending children to the school and saying that, okay, we have achieved universal primary education will probably not so true. Now, I will not get into this. See, again in 2013, if you see, look at this table, that Rajasthan, Uttar Pradesh, they have a trend actually, in these two states. More girl children are out of school than other states. Now, another thing, this is actually 2013 data. I don't have 2014 data at this point of time, but 2013 data shows that actually there is a steady improvement in terms of infrastructure. Drinking water available and usable from 72.7% in 2010, it has increased to 73.8%. Toilets available and usable 47.2% to 62.6%. Library has improved. Kitchen shed in the school has improved. Midday meal served on the day of visit, the day actually the surveyors were visiting that school, they found in 2010, 84.6% of those schools were actually serving meals, and in 2013 it was 87%. So that there is a kind of steady improvement in those things. Now, if you see the three major challenges as I was discussing, that standard 1 to 2, building the foundations for learning, especially reading, listening, speaking, writing, and basic arithmetics. So these are the skills what actually would be used lifelong. So these are the fundamentals. Yeah, that is one of the areas what we are actually lagging behind. Standard 3 to 5, ensuring that basic skills are in place and enabling children to move towards grade level content and skill. Standard 6 to 8, ensuring that the appropriate basic skills are in place and enabling children to move towards grade level content and skills. Now, there was a national achievement study survey. In that also, if you see that same kind of broadly the same finding is generated. Students with only one sibling, I mean, this is, you see that outperformed by the small but statistically significant amount those who have 2 or more brothers or sisters. So that in small families and with one sibling, the children are achieving much better than others. Children who are given homework every day and have it checked by the teachers do better than their peers. Underachievement is common among children belong to SC/ST. This is significant. Scheduled caste, scheduled tribe, and minority groups. Apparently, efforts to enable these children to reach their full potential require a deeper preparation in terms of curriculum planning and not merely in terms of textbook revision and teachers training. So that what kind of pedagogy, what kind of methodology you will be using, what kind of curriculum development would be done to address those, very, very specific requirements of specific segment of our population. That has to be seen. So that, scheduled caste, scheduled tribe, minorities, girl children, their starting point is not the same than like other students, right? So that we'll have to see how we can actually have those kind of specific, our methodologies and pedagogy, our teaching would be, addressing those specific requirements. Now, if you see the SSA guideline, that also resonates the same. It is saying that it's incorporate learning outcome as a major priority in 2014-15 annual work plan. They're saying that incorporate learning outcome is a major priority. So that resonates the same findings what we have been discussing. Under SSA, Sarva Shiksha Abhiyan, the state union territories are expected to plan and implement interventions to ensure learning enhancement in children. These interventions can broadly be divided into 3 categories, defining class-wise, subject-wise learning outcomes, planning specialized programs and interventions including monitoring mechanisms and systematic reform, learning assessment and evaluation of the interventions. I'm not getting into this priority of 12th plan. Again, it resonates that. So that what we can see is that all we have realized this outcome is a problem. Now what we could not crack is that how to do that, right? There are some islands of excellence in few schools, in few experimentations we see, but at a scale, how do we really achieve outcome? That remains a problem. And as we say, that it is not only typical educational problem or pedagogical problem. It is not within the school always. It might be outside the school. It might be parents' involvement. It might be the systemic issues. It might be the poverty issues. It might be the gender issues. It might be the caste issues. So that number of issues now we'll have to look at and see how we could integrate all these issues or factor all these issues to have our approach toward achieving educational outcomes. So that is why when any of you plan to get into education program, sometimes what we do is that we do typical kind of education program, school education program, but we'll have to see that if we really want to achieve and show the model of how it could be done at a scalable model, then probably we'll have to see what are those factors and how do we actually develop that kind of program approach to ensure learning outcome. Now, another big area. So today, I will actually go a little first, and I will try to see that how much we can cover in early childhood care. We will try to actually cover that particular topic also today, so that it will otherwise spill over to the next session. We'll quickly get into early childhood care and development. Now, why it is so important? Now, very briefly, I would say that, we definitely, it's difficult to cover this in half an hour, but still, early childhood experience in any of our lives, for all of us, is very, very significant to really constitute our personality and to form the ultimate personality and ultimate characteristics of a person. So that whatever the experience we have at early childhood, even during birth, even sometimes actually before birth also, the kind of trauma, the kind of stress, the kind of environment we get, even in the womb, that impacts our, growing up. How would we, and that determines a lot that how would we grow up at the adult stage, and how would we behave, how would we achieve, what kind of characteristics we have, what kind of personality traits we'll have. So that it is very, very important that, and it is the most important probably in our life cycle, that early childhood should be taken care of carefully. And that is why ECCD, that is early childhood care and development, is one of the most important aspects. Though I'm covering it with education, but it is not only education in that sense. It is much more than education actually, and we'll have to probably see that. And it's very, very interesting. If you really want to get involved in this, it is a wonderful area to work in, and it's very, very interesting area to work in. And we see visible changes in children. So let's actually have first of all a little bit of theoretical thing, to understand the aspect. Now, this is something what we are referring to framework of Braun-Freiberger. He was an Russian psychologist, and later he went to US and settled down in US. I think he was a US citizen later actually. So what he says is that, this is very simple. It looks very complicated, but it's very simple. That one is that we are born with some characteristics. This is inherent. Like, probably physical, some, intellectual capacity, your IQ, some of those inherent qualities we born with. But at the same time, that is shaped. Our personality is shaped by the interaction or transaction with different at different stages of our lives with different actors, right? And we are a part of the system. So that, at some point of time, we transact with our family members, mother, father, parents, then the immediate family members. Then we start, the next stage is that, a child goes to the school, that is an external institution, they start transacting with. Now, there are some direct transaction with the child, and there are some indirect transaction. Like, like for my child, it's very important, though they don't have a direct transaction with my workspace, but in my workspace, what's happening, that has a direct impact on the childhood. Like if I don't have good, career, probably, I'm not earning that money, or, I'm having a lot of stress in my workspace, that will directly, definitely, as you can understand, impact our child. Now, another thing what we need to understand, you see there is a term called chrono system. That is that with time, all these systems are changing, our transaction patterns are changing, we are also changing, so that it is a dynamic, concept. How do we grow up? So that when we talk about early childhood care and development, we need to understand that we'll have to take care of the whole system, and we'll have to look at a child in this particular system, not the child, out of this system, not the child stands alone out of this system. So that whenever we look at the child, we'll have to look at the whole system what they are actually interacting with. So this is what it is, generally. So, if you get time, look at this diagram a little minutely, you can understand what it is. It's not rocket science. Now, if you see that the child developmental continuum, so below 6 years, I mean, it is actually covering up to 11 years, but if you see that we have, it's a development is a continuum, and actually, it is a progressive state, so that if we miss something, say in prenatal, the first month, survival, care, protection of newborn, if you miss out something, actually it will be progressively impacting us, so that it is cumulatively impacting us even at a later stage of life, right? If you have a traumatic experience, if somebody has a traumatic experience even immediately after birth, that has an impact. Probably sometimes we forget, we have it is in a subconscious or unconscious level, but that has an impact on our personality at a later stage, on our behavior also, right? So that it is very important that we need to understand it's a continuum. It is not that, first year whatever has happened, the result was out, so that next year we can improve on that and we can actually make it up. No, it is a progressive and it is a continuum process. Survival, so that if we look at prenatal, the first month, survival, care, protection of newborn. It's more of care and protection of a child. And it is not only physical, it is psychological also, it is cognitive also, it is social also. We sometimes think that it is an object of love. It is just one side, we love it as a doll, we love it as a toy. It is not like that. The child is transacting, we saw it in the last. Child is always transacting, whether it is saying something verbally or not, but it is always transacting. It is learning, it is shaping its personality, it is shaping its behavior and personality, and also physical. Second month to 3 years, broadly the focus areas are nutrition adequacy, immunization, and cognitive stimulation. So you see that cognitive stimulation, social learning process is starting, right? Again, social learning process is actually, some theories are saying it starts from the womb. 3 to 6 years, socialization, psychosocial interaction, play, and readiness for school through ECCE, early childhood care and education. So that up to 6 years, in some of the best schools, some of the best, early childhood care centers in India, especially the private, big schools and big branded institutions. Even probably some of you have also experienced that with your children, or probably you have experienced personally, that at a very early age, 2 years, 2.5 years, the child is forced to write. The child is actually, when even their, neuromotor ability is not really developed to hold a pencil. We force them to hold a pencil and do something and imitate something and say that, they are learning to write, learning to draw. So that is something not really, required. And it is probably not so good for the children, for their, if you see that, you prepare them psychologically, cognitively, neuromotor wise, give the stimulations, that kind of environment, and basic nutrition and, the loving environment you give, so that the child is growing up to a healthy baby, and also they're prepared to get into the next stage of schooling, the first level. So that is required up to 6th standard, numerical skills, reading, writing, this, that, many of these things we sometimes impose when the child is not ready. And not ready means the child's system, physical, psychological, cognitive system is not meant for doing that at that stage. Okay. Now, in 3 to 6 years, if we actually narrow it down and focus, because, there are 2 stages in early childhood. If you take 0 to 6 years, 0 to 3 years, more of home-based care, right? Whatever the cares we need to take at the family level. Fathers, mothers, sibling, they are more important. And we'll have to see that how do we work on with the family and the parents to have that kind of impact on the children and have that stimulation, to grow up as a healthy child, psychologically, socially, cognitively, physically, etc., etc. Now, the external influence happens from 3 to 6 years, so that, at 3 years of age, probably the child can go to early childhood care and development center. We can have professional, impact on the professionals can start working with the child. We can start working with that. It is not only the child, even ECCD, the responsibility of ECCD to work with the parents and the families. Yeah. Now, what are the focus areas? 3 to 6 years, the determinants the quality early childhood care and education. Again, I said that education does not mean that that child will start doing arithmetics and algebra. Basic healthcare services including disability screening, nutritional adequacy and incidences of intermittent diseases, literacy level of parents, educational environment at home. It's very, very important, that home-based intervention. Outcomes, interest in learning, so that the child it is not there getting literacy skill, they are learning to learn, right? We are creating that learning ability to the child. Language, numeracy, psychosocial skills. So language, again, they not necessarily they will have to start writing, reading, and words and sentences. Language to express themselves, right? Activeness, self-confidence, awareness of environment. Many cases I see in the biggest school, I see that so much of pressure is created on the child. The child is actually getting scared to go to the school. They lose their confidence and they grow up as an inconfident, personality. Freedom from intermittent disease and nutritional security management of any identified disability. The indicators are full and active participation in ECC activities, ability to narrate and story, experience or recite rhymes individually and confidently, demonstration of curiosity by asking relevant questions and experimenting with new things, age, appropriate self-help and social skills, age appropriate height and weight, regular attendance of preschool. Yeah. So again, whenever you get time, you just look at this to understand conceptually child development, different aspects of child development. Now let us look at the status of children in India. We have, every day it is increasing. So we used to have child population 0 to 6 years, 158 million children. 1/3 of the babies are born low birth weight. So they're born malnourished, underweight. So you can understand that if we really want to achieve this, then we'll don't have the scope to work with the children. We'll have to work with the mother even before they get birth, and not mother when they get pregnant. Probably since her childhood she has accumulated that malnourishment, that health problem. That is why the child is getting malnourished. So that it's the life cycle approach we need to have. It's quite a long-term approach we'll have to have. Only 42% children are fully vaccinated. 14% are not vaccinated at all. India has largest number of malnourished children in the world. 47% of children below 2 years are malnourished. 5% of children 0 to 6 years suffer from severe or moderate anemia. 25% million children born each year. Infant mortality rate 70 per 1,000 lives. We have discussed this. 60 million children live in poverty. Of them, only 19.4 million children are getting preschool education under ICTS, Integrated Child Development Scheme. Now, it's not that you will have to remember all these numbers. Broadly, the picture is really grim. The situation is really bad, and we need to see that what we can do about that. As corporate sector. Now, whenever we discuss all these issues, one thing actually should be there in our mind, back of our mind, that okay, government initiatives are there, NGOs working there, but as a private business sector, what could be the value we can bring in this? What kind of the innovations we can bring in? What kind of changed, destructive innovations, which will actually, create a, revolutionary change. Whether we can get into that. Yeah. See, to be very frank, I have been working in this field for many, many years. I have seen so many NGO programs, government programs, corporate programs. What we lack, what we see is that innovation. We have been trying the same thing. We have been rubbing, the same thing day after day, year after year. But we don't see that, sometimes we'll have to stop doing that, repeating that. We'll have to stop saying that, no, it's not working that, it's actually very slow. Can we do something differently? Is there something else we need to do? Can we bring some kind of innovation? Can we think out of the box? In health sector, education sector, truly speaking, there are some technological innovation, few innovations here and there, but I don't see anything really devastating, which has really changed the scenario, which can change the whole perception, revolutionary. We don't see that. So probably, as business sector, you can bring a lot of new perception, you can bring new ideas, think differently, and probably we can, change the scenario. Something we can realize, all of us are realizing that not working much, whatever we are doing, it's progress. We have still remained as one of the poorest country. We have still remained, though if you can argue that our GDP is so high, but at the same time I can argue that, in terms of poor people, we are the highest probably in the world, right? We are the highest. So, what is that solution? So that is what we need to think about. In terms of child development, what kind of innovations we can bring in? Can we target the new generation, the baby who was born today, so that, in few years' time, we see much better indicators in terms of everything. So that is what, how do we actually build up a new generation altogether? Legislative provisions, again, I would say that, whenever you get time, we'll share this definitely slide with you and, get into that. We have a draft early childhood ECC policy also, national ECC policy. It is talking all good about ECC. If it happens, it's really, really good. Now, as I said that out of 158.7 million children, we have 75.7 million children as per 2011 census who are attending ICDS centers, Integrated Child Development Scheme. I will actually give a brief description of ICDS. ICDS was the first launched in 1975 for nutritional purposes. Now, if you see the right hand side, so this is again, mainly this ICDS program is a central government program because the cost is borne by central government. Only 1 rupee per day per child is given by the state government. That is a kind of cost sharing. The purpose was to raise the health and nutritional level of poor Indian children below 6 years of age. This is the biggest child development program in the world. Enormous. To create a base for proper mental, physical and social development of children in India, objective-wise it was excellent. As a program, by design it is excellent. To reduce instances of mortality, malnutrition and school dropouts among Indian children, to coordinate activities of policy formulation and implementation among all the departments, various ministries involved in the different, so that it was a kind of anchoring program. So health department, education department, all the concerned department will actually converge their services for at this age group through ICDS program. That is the purpose. To provide health and nutritional information and education to mothers and young children, to enhance child rearing capabilities of mothers in country of India, to provide nutritional food to the mothers of young children and also at the time of pregnancy period. Now it is also, they are covering adolescent girls. Okay. So if you see, what are the services? Services are immunization, supplementary nutrition, health checkup, referral services, preschool non-formal education, nutrition and health information. Now actually I personally don't like the term preschool non-formal education. I would say that it should be more of a developmental term than an educational term. whenever, I mean, education is not that education in school, but whenever we use the term education, we immediately think that they should be educated, they should hold a pencil and a paper and, some textbooks and this and that. So not that education. So these are the broad areas. Now we see the problem in ICDS, Integrated Child Development Scheme, is in implementation. Again, as I said, that this is the largest program in the world, child development program in the world, enormous scope, huge network, but again we'll have to see what is the quality. There are basic issues. I would say that, if some of you are interested, actually somebody had already picked up early childhood care and development as I think it's Manish. He has selected ECCD as for his assignment. So, it's worth going to the ICDS centers and understand that what are the problem areas and how do we really improve the situation, because definitely it is a very, very potential area to work on. The largest network, very good access, very good objectives and purpose, but at the same time at execution level there are problems, and probably corporate sector can bring in a lot of value to improve the program. Now with that, I will give 10 minutes for discussion. So if you have any points to discuss, share, please let share it. Or if you have any question, let me try to answer that. I definitely will not have all the answers. Let me see what are those. Okay, Mr. Manish is asking that what could be the possible reasons for such a bad reading skills among the children. As I said that, it's very difficult to say it is one particular reason. Definitely a lot of things can be addressed by right kind of pedagogy, right kind of teaching. If we have that kind of very, very specific requirement based learning, teaching system methodology, that is one. Second thing is that you will have to see that, execution level we have a lot of problem, right? Teachers, we know that even, there was a study that to see the teacher skill, many of the teachers, they don't have the skill of, second level, third level. So that is one of the thing is that, we'll have to, a lot of problems in teaching, teacher skill, teaching methodology, pedagogy. But at the same time, there are many other issues also. So that it depends that, that is why I'm saying that we'll have to have a more comprehensive approach. Like it is, we too focus on access. But at the access, what are the other things we could have done? Probably we could not do that. The first priority was to get all the children in the school. Now that stage has come. So that, okay, to answer you, definitely one of the core issue in pedagogy and teaching, but there are many other issues also. As compared to education, how much attention is given to early childhood development in your view? That's a good question. In fact, I would say that, broadly it is in education mostly. Yeah, very, very conventional way. In early childhood care and development, not so much. I see, people are interested, but early childhood care and development as a sector, as a program sector, has not much developed in India, I would say. So I would really like to see that, some of you will take up these programs and, promote this, that early childhood care and development is so important. Like, the previous question you were saying that why it is so bad. We have not started at an early stage. That is also one of the factors. So that is one of the thing. So not much attention I see in this particular sector. Sir, we have other meetings to attend. I would request you to go a little first with the presentation today, considering the time constraint. Miss Anita, from 11 to 1 is the time frame, so that, I would like to remain in that. So I really cannot go as per your time preferences, individual time preferences. So you need to understand that. Miss Nisha Sarah Varghese, she is asking, you mentioned that the implementation part of the schemes are that the real issue. What could be the major reason for that? Why corporate can probably contribute toward? There are many issues. I mean, implementation part, if you see that skilled workers, there's huge training programs and other things, the motivation of these workers, monitoring and, continuous monitoring and support system to these workers. These workers in the ICDS programs are really, really, very poor paid. Their payment is very small. So sometimes that motivation, financial motivation also matters. If you see that, one of the areas, always I say that growth monitoring and counseling is one of the most important component of ICDS centers. And it is all manual. They maintain register, they maintain chart. The small thing in this kind of time, if we have a web-based, at least computerized, monitoring system, so that all data in the computer, in the system, and we can actually link it through internet, a web-based system, so that we can. So those are small things to be done, but those can actually make a lot of differences. So I would say that management of this, monitoring, creating database, giving that kind of incentive, it might be some non-financial incentive to those workers, giving some support. Those are the areas probably, corporate can bring in. And especially the corporate, the technology thing, those things actually, the corporates would be very well positioned to bring in. What probably small NGOs and government could not do that till now, so that NGOs also, are not capable of doing that, so that corporate can bring in those kind of values. To Manish's question, other reason is that even families should encourage early reading and not just depend upon school to do that. Yeah, definitely, early family intervention is definitely, but, there are families, there are first generation learners. So, we need to actually think about that also. Community education, community health, or community health education. Dr. Geeta H. Community education, community health. I didn't get your question quite. Okay, priority wise, you're saying. Well, priority wise, I think the first thing is that the cross-cutting thing or the overarching thing is the community education, definitely. And then, community health education, and then community health. I mean, that is the progression probably I will see in terms of program implementation. Because if I see that, okay, the next question is on health care prevention. Will we be covering this in details? Yeah, definitely. Healthcare prevention also, in healthcare also we'll actually have a session. Probably next session will start health. We'll have probably 2 sessions. We'll require 2 sessions to cover health because it's quite a big, aspect. So I would like to also submit the assignment for the same, Mrs. Sugandhi. Yeah, you are most welcome, Mrs. Sugandhi. This is something really, really interesting area, and I would encourage you to work on this. Please let me know what to be done. Yeah, and the first thing is that to all of you, let me tell you that if you are choosing an assignment topic, you will have to officially declare it. So we'll close this, and you will have to, following that, you will have to share a very small synopsis that what exactly you are working on, what is the purpose, what you are looking at, what is the purpose of that assignment, like that. You have to give assignment areas in the sessions. You will have to actually share those sessions. I have mentioned that. I will ask my colleagues in CII to send you a mail probably. You will have to tell me what are the topics. You will have to choose the topic right now. Okay. I would say that in next within next two sessions probably you should give the topic so that you have enough time to work on that. Otherwise, at the last moment, if you choose the topic, it would be very difficult. And during these sessions, if you have any question, I will try to help you out, right? So it's better that you choose your topic. Okay, so thanks to all of you. And if you have any question, as I said, that you can always write back to me, and I will try to answer those questions through mail, or probably I will actually discuss those questions during my last session. Thank you so much.